Africa, hello Cameroon, and welcome to this episode of Shine Africa. And today we are honored, so honored to have you watching. And we want to talk about something that is very contemporary. We're talking coronavirus, and we are in Buea, the regional capital of the Southwest. And we are still at the Mountain Hotel, and we'd like to thank the staff and the management of this hotel for all the support and the lodging and food that they have given to us during our stay in the Southwest region of Cameroon. Ladies and gentlemen, before I bring my guest, my high esteemed guest to you, put your hands together for this artist. See you on the other side.
Shine, Africa, shine. Shine, Africa, shine.
Stop messing around with the crowd. Now me be the slickest. A lot of fakers nowadays. Time to fly, thing that it happen. For instance, pay rap artists don't make sense. Time to fly, we know to grow younger. Hip hop up on the door, I say I wonder. My course up be cozy and traditional, but on the shake scene, so man they be not under. As time fly, plenty things that change. Now for instance, but many need to feel money pain. I need to learn from any time we need to shine, cause time to fly, thing that it happen. And time passes, never to come back. So many there for it to crack. Why if I be no smonger that it tie waist, better go away again. Take over the king so the way crown. Anything nobody on put for down. As time passes, white color the turn brown. Yeah, white color the turn brown. Oh no. Time to fly, thing that happen. New thing just come out with no quality. Time to fly, thing that happen. You want a pop song for yeah, you know fit your flop. Time to fly, thing that happen. Solution there for down, why you gotta look up so. Time to fly, thing that happen. Baby got the upper eye for your grand now the fear now. Time to fly, a lot of things that happen. One guy belly high, let's say swallow no rapping. Enter the pizza on my eye they open. Many things happen in dark with no lights on. What's the deal, nigga? And what's the problem? Homosexuality is so common around here. All things done pass me now. Billy's in my run, what's I go hide, bro? All side na church, all side na evil. Police all around, but no security. Doctor, they move belly, they send a bololo, but I don't face so all things na mafia. Look, but I don't face so all things na mafia. Blood in your hands is still to claim innocence. Guns in your pack is still to claim innocence. Time to fly, thing that happen. New thing just come out with no quality. Time to fly, thing that happen. You want a pop song for yeah, you know fit your flop. Time to fly, thing that happen. Solution there for down, why you gotta look now up so. Time to fly, thing that happen. Baby got the upper eye for your grand now with the fear now. Time to fly, another generation. All my one for being a leader, now we go follow. Baby got the bend back, they say they too strong. What we used to find though, they say too long. 24/7, they did not online. Android phones, oh boy, I swear I want a punchline. If you're saying no, it's smart, take them easy. Not stress for yeah, I say not easy. Motor to the change, new kind of sickness. Get it to the change for face, la foundation. All team dirty bond to go. Many devil back, dirty bond the flow. Fake politicians doing the fake politics. Fake men have got to preach their fake gospel. Fake artists doing the fake songs. All team not fake for yeah, no quality. Time to fly, thing that happen. New thing just come out with no quality. Time to fly, thing that happen. You want a pop song for yeah, you know fit your flop. Time to fly, thing that happen. Solution there for down, why you gotta look now up so. Time to fly, thing that happen. Baby got the upper eye for your grand now the fear now.
Wow, ladies and gentlemen, Slick Babylo. Thank you very much. Thank you very much.
Shine, Africa, shine. Shine, Africa, shine.
Welcome back from that very beautiful break, ladies and gentlemen, with Slick Babylo. And we are still in the Southwest region of Cameroon. We are still in Buea, and we are still at the Mountain Hotel in Buea. Right now, ladies and gentlemen, let me introduce my high esteemed guest to you. I bring to you the director of the regional hospital in Buea, Dr. N.D. Martin Mokake. Please put your hands together for my guest. Doctor, you're very much welcome.
Thank you very much. I'm privileged.
I'm so excited to have you because today we are in 2020 and today we are talking about coronavirus, and we are talking just to the right person. I think ever since I came to Buea, this is the very first time I'll be talking to the right person who wears the right shoes. And you did ask us to do for you the pineapple juice. Please put your mask on the chair and join me in the kitchen where we do the happy juice, please.
Shine, Africa, shine. Shine, Africa, shine.
Thank you. Yeah, we are sanitizing. We have the Shine Africa hand sanitizer right here. We're just making sure that this episode is okay and safe. Wow. We have our pineapples right here. Do you have a juicer at home, doctor?
Yes, I do.
Wow, this is beautiful. In that case, being a very young doctor, you could just dash into your kitchen, you do some juice and you give it to your wife in bed. Breakfast in bed.
I do that once in a month.
That's beautiful. Our juice is ready. On Shine Africa is gentleman first. So I serve you first. This for you.
Thank you. Shine Africa. The difference.
Wow, this is beautiful. Thank you. What's your favorite color, please?
Most men can't answer that. I actually don't have a favorite color.
Okay. You're going to have my favorite color today. For once on Shine Africa, I'm choosing for my guest.
Very honored.
Wow. Thank you so much. Can you have a sip of your juice, please?
Of course.
Oh, God, this is very sweet. So sweet.
Quite fresh.
Before we take leave of you, ladies and gentlemen, remember that a kitchen without a juicer is not alive. A kitchen without a juicer is not alive.
Shine, Africa, shine. Shine, Africa, shine.
If you are just joining us, you're still on Shine Africa, and I am still in the company of my very handsome and very young guest, Dr. Andy Mokake. Martin Mokake, thank you very much. Doctor, you're welcome once more.
Thank you.
Yes, we're in the era of the coronavirus, but before we talk about that, it's important for us to know a little about you. And I know that the first thing, when I went through your autobiography, the first thing I found was your entrance examination into Q's. That didn't work out for you. And then, no, you passed the theoretical part, and you did not make it through the orals. Was that demoralizing for you?
Yes, it was. Actually, I was too small, too young. Went in there with all confidence after advanced level had boosted up our morals. And then I went there, wrote the exams, finished, and then passed. They called us for the interview. And I was really short. I'm not so tall, though, but by then I was really short. And I went and I saw 4 big professors. And they asked me, do you really want to be a doctor? And I said, yes, of course, I really want to be a doctor. And they said, oh, you come from the Southwest region? And I said, yes. And that was the end of my interview.
Oh, God.
So I was quite confused. I didn't understand why I was expecting something.
Something you had prepared a lot, you had read
some
books.
Textbook information. But unfortunately, that was just it. And it didn't work out.
Can you imagine this? But this it did not discourage you, because immediately after that, you enrolled into the university. The Faculty of Science, Biomedical Sciences? Is that how they call it?
At that time, the University of Buea didn't have the Faculty of Health Science, so it was the Faculty of Science. So
Okay,
most
just
of
science.
us, most of us who could not make the exam were rated to get into the Faculty of Science, and then there were specific programs that you could get into, like Department of Biochemistry, and I was in there, but my mind was actually not there. So I spent all my time in the library reading books in medicine and just looking at medicine law.
Yeah. And after that, so you did not finish that. You went abroad.
No,
You had a scholarship.
Yes, I went abroad to study medicine and then finished medicine and then decided to do specialization at the same time from a scholarship. Well, I turned down the scholarship because I was supposed to do neurosurgery, and I didn't want to do neurosurgery, not because it's not prestigious, not because it's not nice, but I was looking at a possibility of helping Africa better. How many patients would you have to help per month, per day, per week? And so visceral surgery was better for me because...
What's that, please? Can you explain that to some of us?
Okay, it's more of surgery that has to do with soft tissue, especially the abdominal surgery. And we do thoracic surgery too, but thoracic surgery also can have a subspecialty. So it's definitely those kind of doctors who operate on people to make them well.
Wow, that's so beautiful. But then you came back to Cameroon quite early. That's what is, when I looked at your age, I was like, this guy is my second follower. Got it?
Yes, I have a little bit of a lucky history. I was supposed to spend 6 years reading medicine, and I ended up spending almost 5 years reading medicine and defending as the best student of my university.
Yes.
And so the university gave me a direct specialization into neurosurgery, as I said.
Okay.
But I decided to do general surgery. And I also finished and defended my thesis a little bit earlier than I was supposed to. And it made me wonder. I didn't know what to do, so I had to go around the world doing humanitarian services.
Yes. Ladies and gentlemen, we are talking to the Director General, is that how they call it? Director of the General Hospital in Buea, the regional capital of Cameroon. And we are talking in 2020. I keep saying 2020 because I'm not sure in 2021 we're going to be having coronavirus. So I really like to talk about it. We are going to exploit the voluntary services you have offered, because that's something that Africa and the youth of Africa today don't know what to do about that. They don't know how to go about it. We're going to talk about that. But then let's talk about coronavirus in Buea. We're here in Buea. There's coronavirus, and we hear that you've just had one case. I'm not sure. And that the case, I think the person died. Please, can you tell us about the case, or you want to talk about coronavirus in general before?
Yeah, briefly, coronavirus or coronaviruses have been a group of viruses that have existed for a while.
Okay.
Now, the SARS, you must have heard 2002, there were some severe acute respiratory tract epidemics that took place in Asia and other places. Those were caused by the some other kind of coronavirus as well.
Wow.
This particular coronavirus we're talking about in 2020, which started in 2019, the novel coronavirus, is the SARS-CoV-2, which causes the COVID-19. So the name of the disease is COVID-19, caused by the virus coronavirus,
Wow.
COVID-2. So the COVID-19 was, first of all, discovered. We don't want to use the word originated. Discovered in China.
Okay.
And from there, it has
Local
spread.
people like us, we say it started. Local people like us.
Well, it could have been gotten from somewhere else and flown into China and then discovered in China. So we just say it originated, well, it was discovered in China.
Yeah,
China. So, and it's plagued the whole world as we speak. And Cameroon and the Southwest region has had its fair share of the troubles. Yeah. Actually, we have had up to 2 cases confirmed as at now.
2 cases?
Yes, one of the patients
at your
unfortunately
hospital?
died. Yes, we have an advanced quarantine center in the hospital that we've created. And the second patient is actually getting out of it. I'm sure some few days we will be able to declare him completely fine.
Wow.
He has been treated completely. We have some few suspected cases here and there that are still undergoing the protocol for diagnosis. And if they are proven positive, we definitely would have to treat them as well.
So what measures do you take for people who come into the hospital? You know, it was a bit tricky for me to get you because I told myself, oh no, not now. I'm going to no hospital.
Yes, the hospital is a risky place to get to right now, and so we need to minimize the risk. So first of all, we've increased our hand washing points because we know that hand washing is the most valuable tool we have, the most valuable weapon we have against this virus. So we've increased the hand wash points. We've also increased the dispensers for sanitizers. So just like when you're getting into any institution now, you definitely would have to respect some protocol at the entrance.
Even here in this hall for Shine Africa,
of course,
we have a hand wash point. We needed to get everything set before having you here.
Kudos to you. I was impressed.
Oh, thank you.
It's wonderful.
Thank
Congratulations.
You. Thank you.
And so all of those we've been able to do. Some other administrative measures like the corpse removal from the morgue and how many people are supposed to be there. The hospital calls them, gives them a program, gives them when they're supposed to be there. Not more than 15 people are supposed to be there for such an activity. In fact, we've suspended all elective surgeries. Elective surgeries are surgeries that we can postpone to 1 month, 2 months, 6 months.
Okay.
We attend only to emergencies right now to reduce the intake of people in the hospital, which can definitely expose them. And we've also been able to make sure that one patient has just one carer. Gone are those days when a village will come visiting one person in the hospital now. To keep them away from that, we advise them not to come in.
Yeah.
But however, we went further to create a center on our own to harbor these patients and probably treat them.
Okay.
And so we have started with some of our partners like Médecins Sans Frontières. We have the regional quarantine center presently is found in the regional hospital.
That's beautiful.
And so we have 20 beds. We can be able to...
You have what?
20 beds for those, for those people.
That was fast for me.
So we could get 10 of those confirmed cases and 10 of the unconfirmed cases, the suspected cases. However, it takes a lot of resources.
But that's pretty small.
Yeah, for now, it's small. We are also looking at other possibilities to expand. Generally, for the past 5 months, we've not had any free bed in the regional hospital. People come in their numbers, and sometimes we have to discharge some people because there are already patients waiting to fill those beds. So
this is serious.
It was hectic to get space and to get some other materials because we have multi-dimensional parameters for monitoring the patient, oxygen concentrators, nebulizers. We mobilized in the shortest possible time to get those things ready for the patients.
You just mentioned there, before you go on, you just mentioned corpse removal, and we hear that even when someone dies, they can still contaminate someone with the virus. Is that true?
Yes, we have a protocol. We have a protocol that we have developed in the hospital in conformity with the national protocol and the WHO protocol to take care of even the corpses. We have a specific protocol to follow. If somebody is confirmed dead of COVID-19, there is a special protocol to follow. However, we haven't been able to activate this protocol yet because the lone patient that died needed oxygen or breathing support. So we had to ferry the patient to Douala, and the patient was under some respirator before the patient died. So the patient did not die here. So we've not been able to activate that protocol, but yet the protocol is spelled out. At any time we have a case as such, we activate. The minister too has just ordered for the construction of a 24-ward pavilion.
Okay. Here in Buea?
Yes, the works are ongoing.
Okay.
And we're hoping that in a month we might be able
to be ready.
Use this building.
Now,
for this
just
purpose.
before we take a break, I would like to know about, I've been washing a lot of hands ever since this thing started. A lot of sanitizers, the mask, I don't know how you call the temperature stuff that it...
Yeah, the infrared thermometers.
Yes. So are we really having a cure for COVID? When you do that, I've been doing it at the hotel, getting into the southwest region in general, we had to go out of our cars and then we got checked and all of that. Am I sure that I've not contracted the virus or something because of all these checks?
Absolutely not sure. It is clear, and we should make it clear to the public, that taking your temperature, all those things we do, it is not the test for COVID-19.
Okay.
Absolutely not. So sometimes we need to educate the population such that they know, because sometimes you give the population a false sense of negativity when that is not the recommended standardized test. In fact, what they do around your head or your ear, that's just your temperature. And for 10,000 reasons on earth, you can have a temperature.
Oh, God.
You can have a fever. Okay? And so it just shows us that if this patient has a fever, maybe we should take this patient in and then investigate if this fever is not as a result of the COVID-19.
Okay.
But yet, there are many people walking around spreading the disease without any fever.
So why not get what's stopping us from knowing if there are actually COVID-19 cases?
Now, it is an expensive and a difficult venture for you to test the whole country. Some states in the US have started, they've tried, they have difficulties. Now, we look at high-risk people. We've even started, the minister has started in Douala. The minister was in Douala to test high-risk populations. You can't just get into a market and test everybody.
Everyone, yeah.
It's not cost-effective. Those strips are even very, very rare to find in the whole world right now. It's not like malaria strips that probably there's an area of the world that has malaria, so they need it and the others don't.
Okay.
So everybody is looking for those things and it's in high demand. We cannot start testing everybody. But yet, when they ask you some few questions, have you been exposed to somebody who's had COVID-19?
They can be able to know.
Yeah, so from that history, travel history, have you traveled to any of those countries that have been terribly hit? Well, in fact, now Cameroon too can be considered as terribly hit, so you don't need to always travel out to fall in that line. But we have that history, so we can categorize you if you are a high risk or a potential carrier, and then we go ahead to test you. The first test is a strip. We call them RDT, Rapid Diagnostic Testing. We can just know in a few minutes if it's positive. And then we can collect the nasal and the pharyngeal swabs and then send to the laboratory to confirm.
A lot of terms that I know nothing about, ladies and gentlemen. We are going to take a break with Slick Babylo once more. Ladies and gentlemen, put your hands together for our guest artist.
Shine, Africa, shine. Shine, Africa, shine.
Yes, Slick Babylo. And maybe the slickest, and maybe the slickest. Woman get the power. Passy caterpillar. I say people the grace palava woman. People they die palava woman. Some men they fight palava woman. So one day they work at the cry palava woman. Some men they cry, so one day they holler, so one day they wonder why they need a hammer. Before you buy a consistent a woman, therefore they hold for that with the camera. Palava not for day, if you say a woman not for day. This church, you know why you palava, you sister a woman, they can't get the work, I go, they be tell me so I never agree. Now the green now because I see a man begin for day they walk on. The scatter place like a gunyam, woman go day for the jolly chopper. The car is so hungry, friend them, are they bro me, yeah. Woman bole you, they go for air. Woman get the power. Passy caterpillar. I say people the grace palava woman. People they die palava woman. Some men they fight palava woman. So one day they work at the cry palava woman. I say people the grace palava woman. People they die palava woman. Some men they fight palava woman. So one day they work at the cry palava woman. Some men they beat the house and need to finish. 11 years has to finish. Lock the scatter, grass to grow. Feel like the bend, listen as a new design. Who say your money to go, grand friend. Who say the door if you get up? Get it on finish up. They don't go them. Try a wipe for the carry the shock now. Woman get the power, no be lie. Me say baron tester. You go green match boy, enter the trap when a woman is set up for you. That's how you spend, oh, you spend up. For your mind, now you say the work out. Budget the finish, I declare. Me I don't drop, I no copy enter the shop. Woman get the power. Pasi caterpillar. I say people regret palava woman. People they die palava woman. Some men they fight palava woman. So one day they work and they cry palava woman. I say people regret palava woman. People they die palava woman. Some men they fight palava woman. So one day they work and they cry palava woman.
Put your hands together for my fine artist in the house, ladies and gentlemen. Slick Babylo, you're very welcome on Shine Africa.
Thank you.
It's my pleasure having you. You're based here in Yaoundé. You're based here in Buea.
Yeah, I'm based here in Buea.
Where do you come from, please?
I come from Northwest, specifically in Kambe.
Ah, you come from Kambe. Oh, that's beautiful. So wonderful. So when did you start singing?
I started singing that was 2003.
Professionally?
No, not professionally, but I started professionally 2010.
Okay, how many singles, how many albums, how many EPs in the market?
An album. I have 8 songs for now.
Singles, all singles?
All singles.
Are they online? Where can people find those songs? These ones are really very beautiful, I must say.
Yeah, this one, the video is on YouTube.
Wow, beautiful.
You have Slick Babylo.
Oh,
on
that's
YouTube,
okay.
Twitter, Instagram.
And Facebook,
Just
what's it on Facebook? Slick Babylo?
Everywhere.
Yeah, so people can basically get to you. You need some supporters, a sponsor.
Yeah.
Or you're
actually.
comfortable for now?
No, I'm not comfortable.
Oh, okay.
Though I'm
What's the
working in
brand of music you're doing?
I'm doing Afro hip hop.
Afro hip hop. So you basically you're looking for someone who can sponsor you. And as usual, ladies and gentlemen, if you're looking for somewhere to invest or someone to invest in, you could pick up a guy like this and we would show you how you can go about investing and making profit in them. Thank you so much for coming on Shine Africa, and I hope to see you again sometime.
Thank you, man.
Thank you very much.
Shine, Africa, shine. Shine, Africa, shine.
Welcome back from that second break, ladies and gentlemen. And I'm still in the company of Dr. Martin Mokake, the director of the General Hospital here in Buea in the southwest region of Cameroon. And we are still at the Mountain Hotel where we are shooting today, this episode of the show. Doctor, there are very many things that I'd want to talk to you about, especially the post you're holding, consultancies you're having. But first, let us talk about your experience in abdominal and war surgery. I think this is very contemporary, given the fact that you are the regional doctor here at a time when we have the Anglophone crisis. How are you helping victims of this crisis?
Well, I was very much more privileged to be the head of surgery at that time when everything was quite hot. So it was incumbent on me to do what I had to do. So it's not been quite easy. We've been having a lot of nasty cases, more than 100, because our facility has always served as the main facility for the region in terms of receipt of these patients and the management. And so sometimes it used to be quite difficult. I remember some 1st October, we would go out. I would take the ambulance because everybody was afraid.
Yeah.
I would take the ambulance. I drive the ambulance, go to where people are shot, put them in the ambulance, bring them to the hospital, do the surgery, jump into the ambulance and look for more. It used to be quite difficult, but this is the part that we had to play in order to get stability and to take care of the population.
Did you succeed in some of the cases?
Yes, of course, we did. A lot of them, a lot of those cases.
Well, when you talk about victims, I'm a Cameroonian, and I know that some of those cases, sometimes you read it on social media, I don't know if that's true, that especially the soldiers come to the hospitals looking for the separatists, if they're admitted in the hospitals and they take them out. So when you talk about victims, I'm thinking that maybe you're caring only for soldiers.
No, no. We are a medical corps. As respectable as it is, we have no affiliations. No affiliation to a soldier, no affiliation to a separatist. Our affiliation and our allegiances lie to the patient. And whosoever is the patient at that time. In fact, I will tell you a truth, and every doctor will tell you this. If Osama bin Laden, if you consider him bad, or the worst person on earth, if he were to be resurrected and brought back to life and he has a problem in the hospital, it is our duty, it's our oath to take care of him the best possible way we can. So we do not discriminate. We take care of everybody as long as they are human beings. Our oath does not permit us to discriminate for political, social or any other reason.
That's beautiful. But did you have some cases wherein some fighters were taken out of your hospital to jail?
Not any of those cases.
Oh, that's beautiful. At least we're hearing from the horse's own mouth now. Now, I'd like you to give a word to young people out there, because you started professionally with volunteerism, and that's something that Cameroonians don't know how to do. So can you give a word to them on this?
I think that the things we say, the things we do, the things that come our way are not actually planned by us. Certain people have done certain things directly or indirectly to put us where we are. And it is our duty to give back to humanity. I would tell my fellow young men and young ladies that maybe we think that the government owes us something. No. We owe our country something. And we definitely need to give back to our country.
To our community.
Yeah.
And I know that you volunteer. No, you how for many NGOs around here, you are a consultant.
Yes, I'm a consultant for hospitals within and without, and for
international
other international
NGOs,
organizations. Yes,
that's so beautiful. It's been so wonderful having you here, and I know that everyone listening to you would be wanting to ask you a question. So this is that time, ladies and gentlemen, to ask a question to our guest.
Shine, Africa, shine. Shine, Africa, shine.
Hi, my name is Njongo Kate, and I wanted to ask you, talked about this COVID-19 and the little preventive methods you guys are using in the hospital, but we have this news going around of people eating bitter cola and having hot tea with lemon or bitter leaf as the cure to that. I don't know how that actually boosts the immune system from what people say, and I don't know how true that information is. I would really like to know if it actually helps.
Thank you. I think that's a very nice question for you, Doctor.
Yeah, I think it's a very important and a technical question.
I've been drinking it to lemon and hot water. Bitter cola.
Keep drinking, it's all right. Lemon has vitamin C, it's okay. But as generally, we have always had a problem from time immemorial with viruses. We actually do not have something that we can say is a cure for viruses, and this is one of them. However, it is also a dilemma in the medical community whereby we've not had enough time to understand this virus. The prompt or the very swift nature of its ravaging effects has kept us confused because we don't understand it. And when you don't understand it, you will succumb to everything that they tell you helps. So even in the medical domain, we have been trying unorthodox methods against this virus. Some of them have worked, some of them have not worked. It has been natural for other people out of the medical corps to think about what works and what doesn't work. That I give them the credit. Okay. As at now, we don't have any scientific evidence that it works.
Okay.
And so we would leave it as such as scientists.
Wow, okay, that's very beautiful. And now you have been on the hot seat. I want to be on the hot seat now. You have to ask me a question. What would that be?
My question is simple. How do you do what you do?
Can somebody help me answer that? How do I do what I do? Because I love what I do. Very swift question, very swift answer. Finish. Because I love what I do. Did I answer your question?
It suits me fine.
Very beautiful. And now it's my best moment on the show, ladies and gentlemen. We are going to do the dance slot, and the doctor has asked for us to do Sami Diko.
Shine, Africa, shine. Shine, Africa, shine.
es la seule que je veux. Je deviens dingue, oui, sans toi. Tu es la seule que je veux. Je deviens dingue, oui, sans toi. Je ne dirai jamais assez que je te veux, oui, dans ma vie. J'ai pas besoin que ça s'arrête.
This is serious.
J'ai pas besoin que ça s'arrête.
Put your hands together, ladies and gentlemen, for our medical guest. You know, scientists don't even know how to dance, so I'm very surprised that the doctor can dance this much. Unfortunately, the coronavirus will not allow us dance together because this one needed us to dance. Let us see how many marks the doctor has made for himself just dancing. Is it a 5? Is it a 7? Is it a 9? Oh, 9. Doctor, you made 9 marks just dancing here on set. And I hope that you're giving a lot of marks to your students at the university. I've just given you 9 on 10. And teachers like to fail students a lot. I hope you are giving a lot of marks at the University of Buea where you lecture.
We give them what they deserve.
Please, can you leave your medical signature right here? Your name and your signature, please. This is beautiful. We have the signature right here. Dr. N.D. Martin Mokake. On Shine Africa, you do not come and go back empty-handed. So we have a beautiful Shine Africa pillow for you to take home and show to everyone that you were here on Shine Africa. We are so proud and happy we had you on the show. Thank you so much. See you some other time.
Thank you very much. Well appreciated, and I wish you all the best.
Thank you. Thank you very much, Doctor.
Shine, Africa, shine. Shine, Africa, shine.
Before we go, ladies and gentlemen, here is our watchword. It is an African proverb on war and peace. And it says, wars are created by people too old to fight for those too young to die. War is created by people too old to fight for those too young to die. We are still at the Mountain Hotel here in Buea, where we have been for the past 1 week, ladies and gentlemen. And we'd like to thank all of you who took time off to watch this episode of the show, of course, our guests, and also to my crew. And I remain your host, Abongta Mirabel Siringwa. Bye-bye from me to you. Bye-bye.